And look, there's a difference of level between the upper right canine and the upper left canine. This is not okay. This you can call it, if you wish, a cant of the occlusal plane, but this cant of occlusal plane is not a skeletal asymmetry. It's very easy to understand. On the class 1 side, the left side, the cuspids are going into the embrasure of the lower teeth, so they have erupted more. On the class 2 side, which is on the right side, the teeth have been stopped into the eruption with the cuspid of the lower teeth. That's why we have this feeling of cant of occlusal plane. But there is no special wire to use or anything. Just correcting, as you're going to watch it, just correcting the class 2 relationship on the right side will get the teeth into proper vertical position, symmetrical with the left side. And nothing particular to do. So here is the genius sagittal first. So you can see one genius crystal bracket on the canine and two molar tubes on the molars. That's all there is. There is a wire, there's some spring, there is also a stop, and I will explain to you everything in a minute. And as you can see easily, we could correct the class 2. We have a class 1 relationship now on the right side. Okay, this is the other side. It's not because we have used only on the right side that we have lose the class 1 on the left side. So a symmetrical use of the genius sagittal first is very easy. Let's look at the final result. The final result, so you see that the midlines are better. Midlines are better. Why is that? There are two reasons for that. There are many two reasons for that. You know, the elastics works reciprocally. It works on the upper right side, so it will move a little bit the upper midline to the center, and it also works to reposition the mandible forward, especially on the right side, which will help the lower midline to go to the left. It means to the center. Also, you will look at the vertical position of the canine on the right side. Now it's very symmetrical to the left side. Why is that? Just because of the class 2 correction, just because of the class 1. And I will come back to see that the upper teeth now are not against the cuspid, they are in the embrasures of the lower teeth. That's why it could be corrected very easily. There's no wire, special wire with whatever cant occlusal plane correction. I never use those. They are, to be honest, for me, there is no such thing as, except in syndromes, in certain syndromes, real skeletal asymmetry of the maxilla. When you watch those, it's only a problem that comes from an occlusal relationship that brought this evolution. Anyway, so here, now the description of the sagittal first. First of all, first thing, you have to take an impression of your lower teeth. First appointment, you take an impression of the lower teeth. Then, second appointment, you give, you bond, sorry, the brackets, the genius bracket on the canine, could be crystal, could be metal, it's the same of course, and the tubes on the molars. We are still in the second appointment. We'll use a segment of wire. I will talk about the segment of wire later with the spring. The spring is almost no activation of the spring. And you give the patient still on the second appointment, the plastic retainer, if I may say, the plastic mandible tray, plastic tray, that will be the anchorage. And the patient wears 22 hours per day the plastic, lower mandible plastic retainer with the elastics, which is heavy elastic. And that's how we get the genius sagittal first, okay? We have the anchorage, which is the lower arch, the whole lower arch, and we have the active component, which is the elastic. Let's look now in the occlusal view, okay? This is how it looks in the occlusal view. As you may see from the picture, there's a bonded retainer on the upper arch that comes from first phase of treatment and that has no relationship with the genius sagittal first. You don't need those upper bonded retainers, wire retainer on the top arch. It's just there, so I left it there, that's all. It's probably been removed in the later stage of treatment once all the brackets have been